Victor Hugo was right when he said there's nothing more powerful than an idea whose time has come. Yes, the idea of freedom, liberty, and justice for all. Yes, that was the idea, but I declare that now is the time. And if America is going to have a chance at living out the true meaning of its creed, that we hold these truths to be self-evident, that all men are created equal, then we cannot afford for this nation or its leaders to have selective amnesia.
Welcome back to the Policy Lowdown, the podcast from the Maryland Center on Economic Policy, offering straight talk on the policy choices that shape Maryland communities. I'm your host, Kevin Slayton. Last season, Maryland Center on Economic Policy's Kid Count Director and my friend Nonso Umunna joined me for 2 episodes focused on how kids and families are doing here in our state. Recently, the 2023 Kids Count Data book came out and ranked Maryland 21st in overall child well-being. It's an interesting number, and while we're doing better than some other states, this also suggests that we have some work to do in order to ensure that all kids in Maryland have the resources they need in order to thrive. And so again, that's why I've invited my buddy back, Nonso, here into the studio to discuss this year's data book and what it means for families in our state. Welcome back, my brother, Nonso. Welcome back to the podcast.
Thank you, Kevin. It's always a pleasure to be with you.
How was Atlanta? Good.
It was great.
It's an inside joke, folks. I'm just picking with for everyone listening who might not have heard the prior episode when Nonso was our guest, also with Laura Wildry from the Maryland Family Network. Share with us just a bit about Kids Count and what the annual data book means.
So the Kids Count data book is a 50-state report of recent household data developed by the MDCEP Foundation. It analyzes how children and families are faring. And the report focuses on health, economic and other challenges affecting American children, as well as how those challenges are more likely to affect children of color. And then it compares how Maryland is doing with other states. So the Kids Count data book looks at every state in the country, including Puerto Rico and the U.S. Virgin Islands. MDCEP, Maryland Center on Economic Policy, is a Kids Count partner for Maryland, and we help collect data for the Kids Count publications and databases, as well as analyzing the data and sharing it with the public and policymakers. So we also maintain the Kids Count data center for Maryland, which has more than 100 indicators looking at various issues relating to children. And I will encourage listeners to check it out because we update the data yearly and monthly and sometimes weekly. The data book focuses on metrics in 4 domains that can help inform policymakers about how Maryland's children and families are, about what Maryland's children and families are experiencing. To do that, it looks at 4 domains: economic well-being, education, health, family, and community. So for economic well-being, for instance, parents who are struggling to maintain steady employment and cover the costs of housing are not the only ones who carry. We know that parents who are struggling to maintain steady employment and cover the costs of housing are not the only ones who carry the stress of living in poverty. Their children experience it too in ways that can harm their development. Being unable to access food, nutritional food, healthcare, or childcare can influence a child's brain development and readiness to learn, as well as behavior and also emotional well-being. In terms of education, as Marylanders, we all believe that every child deserves a great education, and that starts from the beginning. A lack of access to early childhood education can undermine a child's social and emotional development. We know that that particular early stage, 0 to 5, 0 to 3, is very critical. Health, children's physical and mental health, we know is deeply influenced by other elements of well-being and also affects the ability to succeed in school and pursue other opportunities.
Outstanding.
Family and community is another one, for instance. Living in high poverty neighborhoods can contribute to stress and fuel worries about safety for children.
Interesting. I'd be interested in knowing, while it's important for those of us in the advocacy community to wait for the return of this data, in your assessment, your professional assessment, how important, or what do you think the anticipation is for those policymakers? Are they counting on waiting to see what this data says?
So what I've always found is that the data is very critical for policymakers. When we were doing like county fact sheets, I always find that you'll be surprised to know that most of the people, a majority, is in my experience, of policymakers are not very aware of how children, particularly, and their families, to some extent, are faring in the county. There's always a saying that everybody loves children, but that the constituency that is always, they don't have a lobby, an effective lobby as other lobbyists do. So I always find that the data book, the data fact sheets, the data center has always been useful to policymakers because it gives them a glimpse and a clearer understanding, because there's nothing that really gives you a clearer picture of what's happening in your district than seeing the numbers itself. And the ability to see that is always helpful to inform.
And the data is provided in a way that they can see it based on the jurisdiction
they're in.
Okay,
yes,
gotcha,
yes.
Gotcha.
And we always try to make the data as easy and clear. Not they don't want to make it complicated. So even if we have numbers, we make sure we have percentages to give people the lawmakers a clear picture of what's happening in the district.
So what are your main takeaways from this year's data book?
So like you said prior to the beginning of the show, in the beginning, where Maryland is ranked 21st, that's not where we want to be. Maryland is one of the wealthiest states in the country by some measures. So it can be easy to overlook how many families here are really struggling to meet the basics. The data, for instance, shows that 14% of children, that's about 187,000 kids in our state, live in households with income below the poverty line. And in that, according to the data book, Maryland ranks 18th nationally in the number of children living in poverty. It's also important to remember that having income above the poverty line also doesn't mean that the family is living comfortably or able to meet their basic needs. It provides a consistent national measure, but the poverty line is not a full reflection of the actual cost of living, especially in a state like Maryland that tends to have higher living costs. And we know in recent years with higher costs of housing, food, with inflation, that's a very important thing to look at. In 2021, for instance, looking at the poverty line, for instance, which we're measuring here for children living in poverty, in 2021, a family of 2 adults and 2 children lived in poverty if the family's annual income fell below $27,479. Maryland also ranks particularly poorly when it comes to housing costs.
Are you saying that is the poverty line, the 27.4 number?
Yes, for 2021 when this data book came out.
That family, 2 adults, 2 children.
Yeah,
anything below.
Yeah, below. Yes.
Okay.
Mm-hmm. So for another metrics we look at in terms of poverty, another glaring data that came out from Maryland was also housing costs, and that showed that Maryland ranked very poorly when it comes to housing costs. We are 39th compared to other states. That means that for us, nearly a third of children, about 428,000 kids in our state, about 31% of children live in a household with high housing cost burden, which means that the family is spending a higher income on a higher percentage, of their income on housing than they would reasonably afford. So some of the issues we're going to talk about here, just think about the family that's spending 30% of their income. That means that they're already pressed for making very, very drastic decisions on what other basic needs that they have to be able to provide for their kids. There are areas where Maryland is also doing better. For instance, the data also shows that they are doing better than most states. We have, such as the number of children without health insurance. We've been doing better in that particular area since the Affordable Care Act. But we still have 60,000 kids who are uninsured in our state, and that's 60,000 kids too many. There are other things that the Kids Count data book also found in terms of education as well. We find that there are, for fourth graders not proficient in reading, there's 69% of fourth graders are still not proficient in reading in our state. 79% of eighth graders are not proficient in math in our state. So I think nationally, when this data is 2021 and we know the pandemic had an impact, but even prior to the pandemic, we were seeing these numbers. It wasn't like we had good numbers. So that was an area where we are not doing particularly well in terms of education.
Wow. While many of those numbers, that data is extremely eye-opening, in the past we've had conversations on the role of race.
Yeah.
What do the numbers say about that breakout? What does that? How is that reflected in this data?
So that's a very important question, Kevin, because you know that even when we see, for instance, we're looking at data and we see that there's improvement. Sometimes when you look at disaggregated data, you find that it's not everybody that is doing well. And if we really want to have what we look at as holistic change and improvement for our kids, we have to make sure that nobody's left behind, that every child is doing well, every race, ethnic group is doing well. So, for instance, the number that we talked about in terms of children living in poverty, more than half of that number are Black and Latino kids who are living in poverty. If we're looking at the number of kids who are also fourth graders who are not reading proficient or math proficient, the majority, African American and Latino kids are doing worse off. And I want to emphasize, when we look at the numbers, say for instance, maybe the Asian students or white students are doing a little bit better. That's not, people tend to look at that and think, well, that's the standard you have to look at. But that's not the standard. The standard is proficiency and excellence for every racial group, making sure that, our kids, all of them, are doing well is the most important thing for us to ensure that, our state's future, things are better for us in our state in the future.
That's interesting. Cornel West was right. Even all those, some 30 years later, race still matters.
Yeah.
And while that data is rather eye-opening, this year's data book in particular also focused on the access to affordable, high-quality child care, which is so critical for families, particularly young families trying to make their way, and for overall functioning of our communities and our economy. I think it's no surprise to anyone that the pandemic made a tough situation even harder. What does the data book say about the state of child care in Maryland?
Yeah, so like you said, Kevin, the data book reflects on our child care system today, and it shows that it's not working for everybody, very well for anybody in the country. Parents across the state are facing difficult choices because of high costs or a lack of providers in the communities. And at the same time, we have childcare workers that are often underpaid for the essential work they do. So one of the important things we have to mention in this conversation is that high cost and access are two critical problems for parents. But also, that doesn't mean that the providers, healthcare workers, are being paid well as well. So we have to bear that in mind. Like parents across the country, parents in Maryland are having a hard time finding childcare that meets their needs. Nearly 12% of children ages birth to 5 in Maryland live in families in which someone had to quit, change, or refuse a job because of problems with childcare between 2020 and 2021. And women are 5 or 8 times more likely than men to experience the negative employment consequences related to caregiving. So, for instance, if a parent can find an opening in a childcare at a childcare provider near their home, they often can't pay for it. That's, and Maryland's average cost of center-based childcare for a toddler in 2021 was around just a little over $11,090, which is nearly 8% of the median income for a married couple and 25% of a single mother's income in the state. So, for instance, if you recall our conversation about housing costs.
Yes, if you said it's $27,004 for two children, that's $22,000 there. That leaves the family with, $5,000 to live on?
Yeah, and also if you're looking at a family, for instance, they're spending 30% on housing, and then 25% of a single mother, 30% and 25% on childcare. That's about 55% of their income on these two alone. And if you have other children, you have other needs, food, other basic needs that are just as important. Yeah. That makes a family have to make very decisions and choices. Also, while the cost of care burdens families, it's also important to keep in mind that childcare workers, like we mentioned previously, are paid worse than 98% of professionals. The median wage for a childcare worker in Maryland was only slightly higher than the national average in 2022. That's about $14.02 an hour. And for context, the state's minimum wage is about $12.50 per hour in 2022.
Again, that's a tough picture you paint all the way around, and one that I think many of our listeners will be familiar with, particularly those who wrestle with making those decisions between having to work, having to do childcare, having somewhere. I mean, what do you do? As the young people say, which I'm not a part of that community, the math is not mathing. But what are some of the policy changes that could help improve the situation, both for families and for child care providers and the child care workforce? Yeah,
so the Maryland General Assembly has done some very positive work over the past few years. There are several bills that are focused on addressing some of the challenges that child care providers are facing because of the pandemic that led to the decrease in the number of providers in our state. State leaders have also been working to strengthen the child care scholarship program over the past few years, which has been one of the worst in the country because of the very low pay rate. These changes have helped the program reach more families and also increase the choices for families using scholarships by raising rates so that the program is more attractive to providers. So it's important that the rate increases are attracting more providers, and that helps to address some of the access issues that we mentioned. However, all levels of government also should be doing more to invest in the childcare system. State and local governments we think the state and local governments should continue to fund needed childcare services and also increase capacity so that everyone who needs childcare can access it. Also, Congress should authorize and strengthen the Child Care and Development Block Grant Act, and it will increase funding for public pre-kindergarten and Head Start. We also think that one other step that should be taken is by public and private leaders working together to improve infrastructure for home-based childcare. And that's beginning by lowering barriers to entry for potential providers by increasing access to startup and also expanding capital. Like you mentioned previously, young parents, we think one of the things to do to help young parents is for Congress to expand the federal child care access means Parents in School program, which serves student parents. Those are some of the steps that we think should be taken to help improve the overall child care outlook in the country.
They make great sense, particularly as it relates to home-based child care. A lot of low-income families depend on folks in the community within walking distance, yes, who may not meet or check all of the boxes, but do provide a decent form of child care. Yeah. So hopefully we can see those things take shape in the coming years. Are there also things that state policymakers should be considering to address the broader economic challenges that are facing many of the families today?
So in addition to what we were talking about, school districts across the state have also just completed their first year under the blueprint. for Maryland's future education reform funding legislation, which will continue to provide more resources to public schools over the next decade. So we think that's important and will be very helpful. The legislature has also created a paid family and medical leave program that will help ensure everyone can afford to take time off to care for a new child or recover from a serious illness. And this will benefit many families, but there are still a couple of years before the program begins. Whenever we talk about this, we have to remember that whenever we want to help children, we can't do that unless we address the needs of the parents as well. So parents' needs and children's needs work together in us ensuring that children get all the needs all their needs in order to thrive. Yes. So this year we also have a new governor, Governor Westmore, who has expressed a strong commitment to ending child poverty in Maryland, and we think that's a very good stance that he's taken. And begin that work along with the Maryland. He began that work with the Maryland Assembly this year by passing policies like the Family Prosperity Act and the Fair Wage Act. The Family Prosperity Act strengthens and makes permanent the state's earned income and child tax credits. And this will help to boost income for more than 400,000 families in Maryland each year. So that's a very good step in addressing some of the issues that we've talked about here, including poverty, childcare, and all of that. The Fair Wage Act will also raise the state's minimum wage to $15 per hour starting on January 1st. That will boost wages for about 163,000 Marylanders. These are all great steps, and yet we know that there's still a lot of work that has to be done. First, we need a greater focus on housing assistance, like we've talked about, the cost that parents we know that despite one of the areas where we've seen inflation still stubbornly high is in housing and rent costs. So we still need to have focus on housing assistance. As we were discussing earlier, and as you have talked about in depth in other episodes, Kevin, the high cost of housing in the state is one of the biggest challenges that families' economic security. The recent federal rent relief programs showed how powerful it can be to keep families in their homes when they hit a rough patch. Unfortunately, this is a short-term solution to a long-term problem that Maryland families dealt with long before the pandemic, and the federal rent assistance has run its course. The state and some local governments have put some money into their budgets for ongoing assistance, but that's far from what's needed to meet their needs. I think one of the things we saw during the pandemic is the impact of the pandemic, and we saw some of the problems that were underlying before the pandemic, but we also saw what happens when government makes those investments and gives the assistance, how critical it is for families, working families. Everybody gained from that, and we were all better off for it. So it's something we need to do beyond just the pandemic and just letting go, but try to find a way to make sure that we keep that going for families. Second, while Maryland has made great strides in health coverage in the decade plus since the Affordable Care Act, like you mentioned previously, was passed, there are also groups that are still left behind, particularly immigrant families, and expanding health coverage to all immigrant households and addressing issues like medical debt can create financial challenges, even for households with insurance, would have significant benefits for children and families in the state. You and I know how devastating it is for families when it comes to medical debt. It's a high burden for families, so addressing that is very critical to making sure that families are able to meet their needs and meet the needs of their children. Also, finally, we think that policymakers need to continue working to ensure that major new programs supporting kids and families passed in the past year for instance, like the Blueprint for Maryland's Future, and the paid family and medical leave program are implemented effectively, fully funded, and producing the benefits that the legislators intended. So that's very important.
And thank you for sharing that. Those are all great points, Nonso. And I'm sure we'll be continuing to talk about these issues and so many more in the coming months and weeks on the Policy Lowdown. Nonso, thank you so much again for joining me to talk about this very important data. It's just coming out. It feels like we're just getting it fresh off the press. So thank you so very much. I want to thank you for taking time out to be with us today. To those listening, you can find podcast archives and resources from this episode at mdeconomy.org/policy-lowdown. And while you're there, you can sign up for our email list or support the Policy Lowdown by making a donation to the Maryland Center on Economic Policy. The center is celebrating its 10th anniversary this year, and all of you are invited to party with us on September 27th at the Reginald Lewis Museum here in Baltimore City. We will have remarks from the Reverend Dr. Starsky Wilson. He's a civil rights advocate and the current president and CEO of the Children's Defense Fund, along with other special guests to be announced soon, so stay close. You can find more information at mdeconomyagain.org/events, and you can also find the Maryland Center on Economic Policy on your social media platforms at MD Economy on Twitter and Instagram, and MD Economic Policy on Facebook. Thank you for listening. See you next time.
Those that would stand up, call our nation back toward justice and righteousness are often bashed or labeled as socialist and unpatriotic. Many are labeled as instigators and rebel wild